So, quick video on toothbrush cleaning. So, Hannah's going to show us wetting the brush. The toothbrush that we use for Beth is pink. It's always in the pot. So, tiny bit of toothpaste, like you would normally, like a pea-sized amount, kind of a bit larger than a pea-sized amount. And then we're going to go through and clean. So the first thing that we need to be able to do is take out the gum shields. So to take them out, sometimes you'll need to kind of have a little bit of a wiggle, but you want to get your fingers underneath the gum shield so that you can lever it out. It's always easier to start with the top one, and then you can get to the bottom one as well. So just levering it out from the side, popping it down. If you just pop it down on the side like Hannah's done there, and we're going to clean it afterwards. The first thing we do is start by cleaning. So you'll need to work out your own kind of rhythm to this. You just need to think about making sure you've covered every single surface. So good scrub, making sure that you've gone through the sides, on the underneath, and all around the back and behind. Some parts of Beth's mouth are easier to get to than other parts. So you will end up with bubbles. In terms of making sure that you're giving it a good scrub, you can see the Hannah's going right down to the sides and the back there. So that's really good. You need to get all of the surfaces of the teeth. What you want to think about is the amount of pressure, so you're not just tickling teeth. Just think about what you do with your own teeth. You're not scrubbing the life out of them either, but I'm being careful not to bash Beth's mouth and cheeks and stuff, but we are making sure that we get every surface clean. So as Hannah's doing there, going around the backs and the insides as well. If you do end up with creating a lot of bubbles and you get bubbles all over Beth's face, just wipe them with a tissue. If you get toothpaste on your skin and around the corners of your mouth, sometimes it can sting a bit, so we don't want that to stay there. But it's fine if there are bubbles. And then once you're happy that you've covered every surface, we suction first. So we're going to get the suction catheter ready, wiping off those bubbles. And we're going to do a good suction. When you suction, you're just wanting to go around all the parts of the mouth. Particularly on Beth's left side is where the bubbles kind of can congregate. And then we're also going to make sure that all the way back down the back of her throat. Oh, judder. So Hannah's doing a great job of going in and out all of the crevices. So all the movements with all suctioning is nice smooth movements, so it's not jabby movements, but we are getting in all the different places. Sometimes you have to almost think of the catheter as being the extension of your finger and think, where's those fingers going and press out. So right down the back of the throat there, feeding it through. What we don't want to do is it's okay to leave a bit of toothpaste on the teeth, but what we don't want to leave is lots of secretions for Beth, or toothpaste for Beth to swallow. And once you're happy that that's all clear, then we do the nose as well, just because it does get down the back of the throat and up to the nose, so it's always worth doing a clear out of the nose. And then the next thing we need to do is we need to get the gum shields ready for putting back in. We want to make sure they stay nice and clean. So you can see they're a slightly yellow colour. They go yellow quite quickly, but we'll go through. So what we're going to do is just rinse off the toothbrush, make sure that's out of the way, and then we're going to use our fingers under the cold tap just to give them a good rub. And you want to, as Hannah's doing there with her fingers, scrubbing with her fingers, you want to move from anything being slimy being off it, and it wants to be, it does squeak. So it is proper squeaky clean. These need to stay wet, so you don't have to dry them off or anything. I often dry my hands off because I don't drip everywhere, but I don't dry the gum shields. They need to stay moist, otherwise they crack. If particularly like in the winter, sometimes you can feel that the gum shields are really cold going on against Beth's mouth. You might want to just quickly flash them under the warm tap to make sure they're not freezing. Anyway, so putting them in, you need to be able to check. I'll just show them, Hannah, a minute, the difference between the two. If I can. So we've got the top one, it's got the bigger teeth at the front, and then the bottom one is smaller. So you just need to work out which one's which. I would always suggest starting with the lower set to get that in first, because your top one's easier. So getting them in, we're putting it underneath the tongue, around the front of the teeth, making sure that the tongue is free, and then giving that little wiggle. So the same again, underneath, making sure the tongue is not trapped, and this one, top one, making sure the lips are not trapped, and then as Hannah's just done, then giving it a little wiggle to make sure it's in place. So if you can see best top teeth through it and it's not moving, then they're in the right place. Them's teeth cleaned.